Dr. Malik, thank you very much for agreeing to be interviewed by us. I wondered if you could please introduce yourself and your position within the Pakistani government.
Thank you, Tim. Welcome to Pakistan. Really welcome you from the people of Pakistan that you come over here and addressing a very important issue. My name is Dr. Mukhtar Malik. I'm coordinator to Prime Minister and on National Health Services and looking after this Federal Ministry of Health right now.
With respect to antimicrobial resistance, what do you think are the main issues that are facing Pakistan in the here and now?
I think firstly Pakistan is one of the most important countries in respect of the antimicrobial resistance, because we have a very weak surveillance system right now. And after that joint external evaluation and what we have come through those reports and what we have think that we need to have an improved data collection system in Pakistan about the antimicrobial system. And to address the use of the misuse and overuse of antimicrobials should be addressed in a way that they should be curbed, their use should be curbed, and generally in the clinicians it should be given, especially working in the rural areas of Pakistan, that they are abusing, they are not overusing, they are abusing the use of antimicrobials right now. And we are very much worried about this issue and the way the hospital-acquired infections are increasing in our hospitals, the way we are encountering every day through multi-drug resistant organisms. So this is very worrisome for us right now. And I think we should come up with a strategy to address these issues right now. And the most important thing which we are lacking is the coordination between the stakeholders in Pakistan. And this coordination system should be formulated and should be very much in lines with different standards, where we can have the proper data collection about the antimicrobial strains and different bacteria which are resistant to antibiotics.
So you mentioned surveillance, and that surveillance isn't perfect, and there's quite a lot of work to do with respect to surveillance. You know, why do you think that's been a bit of a problem? Is it to do with the access to diagnostics and affordability of diagnostics?
Being a medical background, I think we should work, the world community should work to come up with a some diagnostic tool where we can accurate the culture sensitivity. Now it took around 5 to 6 days in getting that culture sensitivity reports about the microbial, which antibiotic is suitable for this kind of infection. So what we are lacking right now, and the world should come up with some diagnostic kits, some rapid diagnostic kits for this kind of, to addressing this antimicrobial resistant issue. So I think in Pakistan, when you talk about surveillance, we don't have a data sharing with the hospitals. We don't have a data sharing about what kind of resistance the patients are facing, what kind of antibiotics being used in that hospital, and what kind of multi-drug resistant organisms they have come across during their treatment of the patients. So these are the things I think we should have a complete, authentic data on it. And when we collect that data, I think we can come across certain plans to address that issue of AMR.
When we've worked in the many hospitals that we've worked in Pakistan, by the way, it's been a privilege to do that. We often find that actually the cost of diagnostics is very high compared with the cost of the antibiotics. And so there's always sort of this sort of veering towards giving antibiotics empirically without doing the diagnostics. So is the cost of diagnostics, particularly for critical infections like sepsis, an issue in Pakistan with respect to sustainability and how you can bolt that, if you like, into Pakistani hospitals?
I think there are certain things. Here we have, you can say, some human resource issues also. That's why the prices are so high, especially in the diagnosing of these kind of bacteria and strains, particular strains. And secondly, to bring those prices down, we have to ask. I think we have to ask at this. We don't have to. We have to formulate a plan over here in the Federal Ministry that should address the pricing issue by cutting the, I think, the custom duties on those, by cutting the taxes on those. And that can, I think, address the price issue in Pakistan.
Right. You mentioned earlier on about bringing stakeholders together in Pakistan to like have a more coordinated system in terms of surveillance and data sharing. Who are those stakeholders? Are they kind of ministry?
After 18th Amendment, the health is devolved in the provinces. Now the provincial governments are the major stakeholders in giving primary and secondary and tertiary level healthcare to the patients at large. To the there, as you know, there are 20%. We are amongst the low and middle income countries, and there are 20-25% people living below the poverty line. They have only one choice: going to the public hospitals. And the data collection is not at this point of time is not part of federal government plans, or you can say comes into the ambit of federal government. So the major stakeholders are provinces right now. The second major holders are the hospital managers, who are managing those hospitals, and they should come up with the plan. They should make it happen that they should collect all the data by having a good responsive system there in their hospitals, collecting all their hospital acquired infections, what kind of infections they are encountering over there in their hospitals. And secondly, most importantly, at provincial level, the data should be shared with all the provinces. And likewise, I think internationally with the neighboring countries, with the regions, we should have a data that if in Bangladesh or in India or supposedly in Afghanistan they are having some multi-drug resistant organism, they should share data with us also. So we can also work on it. Secondly, I think this data sharing can make the world understand what kind of things happening in this region, and accordingly you can formulate plans to address those issues.
Yeah, so like have a sort of a coordinated South Asian sort of data sharing network would be good. So as we know, the last United Nations high-level meeting on antimicrobial resistance was 2016. That was, some people say it was successful because we had national action plans put in place. Some people would say it wasn't successful, and now we sort of have to kind of move on. And if you think about where 2016 was, we've had COVID in between, and the world's been a very sort of different place. How do you, or what would be your message to United Nations to address the needs in Pakistan? What would you like to see happen?
First of all, I must appreciate that meeting in 2016 had really people. After that meeting, the world has recognized the issue of antimicrobial resistance. Before that meeting, it wasn't a bigger issue for anybody. The use of antibiotics, after that, people started to understand that we are not getting any new antibiotics right now, and we have just few antibiotics to play with to fight this antimicrobial diseases. And after that, people started to understand that we have to use it very consciously, because this is what we have to fight for the next generations to come, to fight this bacterial infections. So after, I think the United Nations message would be that put it in the priority list. I don't think so this is in the priority list, and this is a very bigger issue to address to. And to make countries work on their national action plan, there should be some accountability for the countries. There should be accountabilities at the world level that what you people are doing about this important issue right now. Because we have seen patients in Pakistan who are not responsive to any kind of antibiotics. Regardless, we have diagnosed that this is a septic issue, and no antibiotics is working on them. And we have lost lives, and we are losing lives right now because of the abuse or overuse of these antibiotics. So there should be a plan formulated at the national and at the United Nations level, and all countries should be treaty and signatory of that plan, where they should share data, where there should be a surveillance system, and there should be accountability that how they are doing. And this Fleming Fund and everything should be attached to those, their fund release, and their system should be accountable at the highest level.
Okay, thank you. So, kind of looking at September and the United Nations General Assembly high-level meeting that we're going to have in New York, what do you think, going past that, because lots of people see that this particular meeting is sort of an end in itself, whereas many of us think actually this is just the start of a new beginning, if you like. What do you think the next 5 years, or what would you like to see?
I
in the
think
next
the
5
way
years?
forward for this is One Health. That antimicrobial resistance is not the abuse in humans, it is the abuse in animals also, plants also, and the other species also. So One Health should be, One Health action should be effectively imposed on every, and they should not only monitor the human side of this antimicrobial misuse, they should also focus on the plant side, they should also on the animal side, and together they have One Health system should be effectively imposed on every thing. And for that, I think United Nations is the best forum to tell people, to tell the countries what is happening and how they have to address this in the coming next 5 years. So this there should be, I think, fruitful discussions. The discussions should be for the strengthening the surveillance system of the AMR. The system should entail standardizing surveillance systems of the countries, and I think these kind of things should be discussed at the UN, and there should be fruitful discussions.
So you mentioned One Health because it's very important, because antimicrobial resistance just isn't in the hospitals, it's in the animal sector, and we have to deal with things like sewage, animal waste as well, etc. That is actually intrinsically linked to climate change, and both of these issues, AMR and climate change, are the big health issues going into the 21st century. How important is, a few years ago, there was this huge flooding going on in the south of Pakistan. It was the size of Switzerland, and many thousands of people died. So how important is climate change to Pakistan, and how is that sort of linked into AMR?
I think we are the one country who is facing this climate change issue most disastrously in the world. And we are amongst the top 2-3 countries who are facing this climate change problems here. Heavy rains, right now we are having this rain spells, and right now we are having urban flooding in some cities of Pakistan right now because of the untimely rains. And I think if you connect AMR with the climate change, as you have mentioned, that animal waste and everything, and those infections over there, you should have heard that there are many infections, especially cholera. There was a cholera outbreak also in Sindh, and there were other small, but they've been contained and they've been addressed properly at that period of time. And I think that climate change is also playing a very important role, pivotal role in exacerbating this issue of AMR in Pakistan. And after we have seen, after post-flood time, we have seen that the AMR, the antimicrobial resistance has happened more in that southern part of Pakistan. So this means that One Health surveillance system is very important. One Health system should be effectively imposed in Pakistan.
Dr. Malik, thank you very much. It's been an honor to meet you, and thank you for answering
Thank you very much. I am honored too, and would like to extend my all cooperation from my ministry, from the government of Pakistan for addressing this important issue.
Dr. Malik, thank you very much.
Thank you very much.